Well, welcome everyone. Thanks for joining today's webinar, which is a case study webinar with RX Outreach about their matching campaign in direct response to a tornado that ripped through Missouri. We're going to talk about all of that. But before we get started, I just wanted to offer a quick breath, as I always do. I know everyone's transitioning from different meetings, so take a deep breath in for 4, 3, 2, sigh. Your deepest breath of the day, breathe in for 5, 4, 3, 2, 1. Drop your shoulders, sigh. Ah. Before we jump into our webinar today, I just also want to do some quick laying of the groundwork of what we're talking about and what we're not in terms of matching today. So we are not talking about employer matching. That's like I work at Delta Airlines, I donate to Habitat Humanity. Delta matches my donor donation to Habitat. We're talking about social donation matching, which is giving the ability for nonprofits to empower any one of their donors or sponsors to put up a match directly on their website. Really quick flyby of the tech, and then we're going to focus more on the humanity here. Anyone can put that match up really easily through MatchNice. It shows up on your website through a matching banner. There's a lot of psychology that goes into maximizing donation conversions, gift size, getting new donors, which we're going to talk about today, retention and revenue. And this is what that banner would have looked like on the RX Outreach website. So, with that, again, zooming out of the tech, it's really just the tip of the iceberg. We're going to focus more on the humanity and the strategy and the actual work that it took to make this matching campaign successful. So, hey, Roy, what's up?
Hey, Julia, how you doing?
Good, good. Let's do a little intro. Tell us about yourself, your role, and the mission at RX Outreach.
Yeah, so Roy Whitley, everyone. Nice to meet everybody or see everybody. I have the honor and privilege of serving as President and CEO here at RX Outreach. And for those that may not be familiar, RX Outreach is a nonprofit nationwide mail-in pharmacy licensed to ship all over the country to include DC, Puerto Rico, and Virgin Islands as well. Uh, And really, the mission behind the work that we do is about reducing financial, social, and geographic barriers to accessing affordable medications and sometimes free.
And Roy, you've stepped into this role not too long ago. Like, what was the organization focused on then that maybe has changed or has accelerated since you stepped into the president, CEO type role?
Yeah, good question. I stepped in CEO role as interim back in August of 24 and kind of stood in more permanent, I guess, in January of 2025. And really, I think, as I think about where we are today and where we're going versus where we were, the model was very much on a population of individuals who were of a certain federal poverty level. And the landscape for healthcare has just shifted. Many things have changed to include the onset of COVID, telehealth, and just changes to overall health plans and things of that nature. So really, you take a step back and you start to look at that and you think about that. It's really a model for the working class, not only individuals who don't have the financial means to take care of everything, basic necessities, I would say. Uh, and so we've shifted a little bit to that so that, we're able to cast a wider net and provide a better service for individuals who are struggling every day with high deductible plans, no insurance, gig workers, you name it, hospitality, restaurant. There's people all over the spectrum.
And Roy, we met serving on a board of a nonprofit together. And one day I got a text message from you saying, "Hey, can you jump on a call?" Tell us about like the situation that brought us together in that moment.
So I'm a St. Louis City resident. grew up and had family in some of the areas that got hit pretty hard with the tornado back in May of 2025. That Friday night, after seeing some of the devastation for me personally, like, hey, I don't know what we can do because we don't, as an organization, really do disaster relief work. But this is our city. This is my city. We need to do something. Um, Reached out to our development director, got on a call Saturday morning, just said, hey, I know of a guy who has a matching platform. We have somebody who's willing to put up some seed funding, if you will, or some funding to start a match. Let's call them and see what we can do because that's going to be the quickest and the best way, really, to get the dollars that we needed to do what we were doing, which was providing free medications, free replacement medications to individuals who were impacted. So I think that call probably came through to you around 8:30, or that text around 8:30 or 9. You and the team got on pretty quick, and we were in the trenches. It definitely wasn't without some challenges and things, but I think having you guys there, having your support there, working with us, I was working with you guys to just remove all and any barrier that we could was pretty good. I think by Saturday night or Sunday morning, we were up. Still a few challenges. By Monday morning, we were 100% live, which I think speaks volumes as well to just kind of the organization that MatchNice is as well.
Yeah, it was really cool to just roll up our sleeves and make this match happen. And, this was one of the first major fundraising campaign pushes that you all had. Share a little bit about your overall kind of revenue model at the organization and why it was important for you to launch a fundraising campaign with matching included.
Another great question. Like myself, our development director was new to the organization as well. She joined us in late 2024. We came in with not a huge donor base or huge donor dollars or grant dollars even. And so this, I think, was a unique and interesting opportunity. It wasn't necessarily in any of our strategic focus. This just kind of happened, but learned a lot going through this. At least for me, this was kind of my first foray into fundraising from the other side, having served on boards and things. It's just different, right? Uh, but the program model has traditionally been and still remains a program service fee model. So that's about 98% of the total budget that RX Outreach has. And then we go out and we do some grant. We apply for different grants. We do some fundraising things and looking to kind of scale that even more because, as I mentioned earlier, the landscape in healthcare has shifted. And so now you see a lot of folks who are self-insuring, which is kind of scary. Um,
Yeah.
but then you see folks who, with changes to Medicaid and Medicare, just don't have the means that they need to be able to afford the medication. So, as you can imagine, in the work that we do, we also take those calls. And so there's the communities across America are knocking on the door and looking for help. And so fundraising is kind of more of a strategic priority for us as we continue to move through 2026 and beyond.
And having seen some of the photos from just the devastation of that tornado, it wasn't just like it ripped through an open field, right? Like there was some serious impact in the city. Like, what was the thinking that happened like in that moment, and what made you like what inspired the organization to want to step up and engage the community in a fundraising campaign at that moment?
Um, the community looks a lot like many communities that we serve across the country. And so we understood and knew very quickly what the impact to individuals was going to be, not necessarily in that moment, but the longer term. And it's still proven out today, even, right? Like there are folks who have houses in their families for, decades. And now these homes have to be torn down, and folks have never had to worry or think about where else, what other community to go live in, or even, even deal with any of that. So for us, the motivation behind that was one, this is our city. Two, we understand people's lives are about to be changed forever. And the point of the fundraising kind of had two prongs. There was the initial phase of like, hey, there are going to be people who lost medications because literally sides of houses were gone. People's homes were just demolished, right? But the other phase of that was we understood the recovery efforts were going to be 12 to 18 months. And so, kind of kicking off that match was really a way for us to make sure we drum up some dollars to be able to continue to stay the course because we understood and knew that individuals were still going to need some need. That's still proven out to be true. We still take calls uh, daily, honestly, inquiring about tornado relief efforts and like how can we assist.
One of the coolest outcomes that I don't think we were expecting at MatchNice from this campaign was just the increase in donor awareness that came from all of the promotion that were doing, the knocking on doors, the uh, ability to say, "Hey, there's a match going on top of all of the great awareness that you all were driving." How did you see matching playing a role in shifting the energy around this campaign?
Yep. I think given the situation, I think there was a natural reaction amongst people to want to do something, even those who may not have been directly impacted or live near the area. I think when you look at natural disasters, fires, things of that nature, to the level of devastation that the May 16th tornado was, there's just a calling on people, I think, to respond. I think adding the Match Nice banner or having a match really provided individuals to be able to um, donate who may have thought or may have not have donated previously because maybe they would have thought $1 or $2 or $5 wasn't enough. So I think the power of a match kind of works twofold. Obviously, you kind of use that as a carrot, right, to be able to double up and increase the donor capacity. But I think as I think about folks just in my network, they may not feel good about $5, but they feel great about, okay, if I give this five, this is going to match it at five. And so now that's 10. And my $10 now is probably covering somebody's 30-day fill, which in fact it was, right? Uh,
Mhm.
so I think that helped tremendously. We definitely saw an increase, a pretty sizable increase in donors from where we started in doing that. Now the work is on whether or not they continue to be recurring donors. Again, that's more like a disaster, so that was a unique situation. But I do think um, all of those things kind of together in some of the messaging that had to go out there really kind of put RX Outreach in a different light to many different people that had not heard about who we were or the work that we do. And so, we continue to stay that course.
And just to highlight a quick note from the case study, you all were able to almost double your donor base, and the match played a role in that. What were all of the other elements that had to come together to make this campaign successful?
Man, I think honestly speaking, Puya, it starts with our development director and really helping us get the story down, right? I think she did phenomenal work in helping us create the storyline of like, what exactly is this going to do? And how do we present this to people in a way that they understand exactly what it's going to do? So I think that was kind of the grassroots even as we were working with you guys to stand up the match, that was kind of being developed in the background, right? Because it wasn't enough to just go say, hey, we want to go raise $5,000 for tornado relief, right? It was more about what exactly are we going to do with this money, and before we take anybody's dollar, we want to have that plan down. And so that made messaging easier. We used our different social platforms, our different networks to be able to say, hey, we have this match opportunity, checked in at different intervals to like refresh language and trying to drive donors to try and make that last push as well. I think from a community perspective in St. Louis, obviously a lot of these donors were local to St. Louis. Again, what it has done is allowed us to kind of remain relevant and be seen as a leader in the community. Whereas before, a lot of folks didn't truly understand and know who we are, what we do. So this gave a lot of credit worthiness, I guess, if you will, to community as well to say, hey, this is how RX Outreach shows up, in a community.
Well, I love that you all started with that, and it's something that we're finding with many of the organizations that we're partnering with. Like before you even talk about how much you want to put up as a match, like what is the time period, what is the multiple, like you really got to get clear on the case. Like what is the case for support? What are the outcomes that you're looking to drive? You had a very specific moment that you rose to in that situation. Talk a little bit about just like the process of building that case and maybe how that trickled into the overall strategy for the match, as well as the communications and the on the ground door knocking and work that went into making this successful.
Yeah, disaster relief isn't what RX Outreach does, right?
Yeah.
Uh, we do medicine. And so for us, that was a little bit of a challenge because, we almost did like a pseudo SWOT analysis, right? Like, what are we really good at? And what can we do? And how do we show up? And from there, we were able to kind of draw a roadmap, which then, to your, point you made, led to some different inroads with local pharmacy school, one of the hospital systems here, where we actually had people knocking on the door asking us how can they help, how can they volunteer, and they went out and canvassed on our behalf. Um, Door to door where we couldn't. And then we ended up partnering with the local hospital system here where we became kind of the conduit as the medical professionals were going knocking on doors and seeing patients and finding out this person's without this med or without that med. We were that kind of that conduit. So they would take all the information up front and get that info to RX Outreach for us to go do. And there were other instances even where we didn't necessarily always fill the prescriptions ourselves. Sometimes patients wanted to remain at the pharmacies that they were at, and the pharmacies were willing to refill, but they had copays. So we would actually go to the copays and go deliver as well.
Oh, wow.
Because in that journey, what we learned is there was a lot of resources being given to people. And even for me, it was an aha moment. We were doing a lot of stuff on social, trying to get in newspaper, trying to get on radio. But then we learned as we were going door to door, folks didn't have electricity. So guess what wasn't happening? No one's charging a cell phone. They don't have electricity. Folks are kind of bolted down to want to protect their stuff. And so, it had it not been the power of partnerships, I don't think it would have been successful either, because just handing out the flyers and stuff just aren't enough. In this space, I think access gets created a lot, but sometimes education and getting access to that access lacks. And so having partnerships and partners that are willing to kind of be in that fight with you, um, I think is what really made the campaign successful, or at least made the use of the dollars successful. And we've been able to tell donors, how those dollars were used and the impact that it made. And we even got some local news publicity and stuff like that too, not from a RX Outreach branding perspective, but more so for other folks in the community to understand and know that, hey, this is a legitimate source you may not have heard of, but like they are doing this work, and if you need it, it's here.
And first off, like the case statement development, having that clear outcome, the importance of actually going back to your supporters and sharing the impact of their donations is such an important step beyond just sending that transactional thank you for your donation. What was the overall impact at the end of the day that you were able to go back and communicate just from this campaign? I know there's ongoing work that continues to this day around that, but share a little bit about just like the storytelling that happened after the campaign.
Yeah, and I apologize. I don't have the numbers right in front of me, but I can tell you we were moving quite a bit. The entire RX Outreach family on the inside were pulling together and doing different things. We didn't have to pay couriers to go pick up meds and do things because employees were volunteering. Like,
Mm.
hey, when I get off work today, I want to go drive down and do that. Definitely a couple of hundred prescriptions for sure. I'm drawing a blank on the total dollars um, to year to date that, or through this period that we're actually able to do. But as a part of kind of the thank you letters to individuals, we made it a point to point out, some of those statistics included just overall annual report because in that moment it became more than just the tornado relief. That was kind of what introduced people to RX Outreach, but we really wanted them to know what value RX Outreach really brings to communities by way of providing folks access to affordable medications. And so, kind of using that as an opportunity to educate and hopefully cultivate and keep them as lasting donors, because the reality of it is there's millions of Americans out there for various reasons who are not able to afford their medication, let alone healthcare, and navigating some real challenges out there.
Thanks. And what I'm hoping our conversation conveys, Roy, again, going back to that iceberg visual, like the technology is just the tip of the iceberg. There's so much other work that goes in to make these campaigns successful. You mentioned the match creating a degree of credibility and urgency to, and making it easier for people to rally around and maybe simplifying the decision making for donors. How did you see that psychology play out in the campaign with the match?
It's a great question. I think because it was our first, it's hard for me to really compare, right? But I can tell you when we first got it up, it was a little bit of a sputter, and then it just seemed like uh, things just kind of took off, right? And even internally for us, right? We just wanted to go see the tracker. We didn't necessarily know uh, who had donated, how much had been donated, because there's a delay, right? But we were able to go to that tracker and it just became a thing where it's like, okay, now psychologically, we need to go say something else and refresh this in our socials and things. Talk to our board, talk to people in, community and network to like, hey, this is still here. And fortunately for RX Outreach, we were unique in what we were doing. It also, led to us kind of working with the governor's office here in the state to get some rules changed to be able to allow pharmacists even to write prescriptions for folks who are impacted by the tornado. So I think psychologically, it hit on a whole lot of different topics, but it was also something that I think everybody was kind of impartial to because at the end of the day, the community in St. Louis that the tornado struck is one that is high poverty and known to be. So I think that in itself, the psychology there kind of pulled people together to want to do something. And folks were figuring out which ways, right? You have people going down to clean up. You had Tesla show up with trucks to be able to charge people's phones. I think it just brought a whole world of humanity and compassion that people wanted to get together on.
Ah, deep breaths of that, man. That's beautiful. And that's actually an insight for me that I don't think I'd really thought about. So much of the psychology of the matching banner is around creating the transparency, urgency, the social proof, community, the gamification around giving. But to hear you say that as a leader in the organization and as the organization also tracked the progress, it created urgency for you all, the signals for you all to go out there and continue to promote. It's one of the things that we've learned as we're wrapping up here is that there's a lot of anxiety that comes from putting up your first match because you just don't know how people are going to react to it. Ended up doing pretty well. What outcomes surprised you the most from running this campaign?
I think the success behind the money that was raised, again, that was kind of my first foray into that. Our development directors had some experience with some of that stuff. But for us, I'm going to say coming out of the woodwork with this campaign and not necessarily being known too well in the community, to have seen as many individuals contribute to that and be a part of that, I think is what surprised me the most. Now you may say, well, why even throw a match up there if you didn't think anybody would go and match towards it? Uh, I just assumed that we would probably have seen more of board members and that type of folks matching, but what we ended up seeing more was just community people
Beautiful.
matching. And it was good. It's a beautiful thing. Makes us proud, not just for the work that we do, but more so, we were able to pull community together in a unique way that, unfortunately, a lot of areas that get hit with disasters don't get to see. And that's not me talking, that's FEMA, reached out and told us that themselves, right? That this isn't something that they've seen before, and communities need it. And so for us, it highlights uh, who we are, what we do, and the power of philanthropy when community takes care of community.
Yes, that's it, man. It's all about people, relationships, and matching is just that tool that can help create the magnet around that. One more question as we wrap up, Roy. What would you say? What would you say to another nonprofit leader who's considering doing a matching campaign but may not have the time or capacity to or confidence to give it a shot?
Man, that's great. I start with the time, the capacity, and the competency, right? As it relates to Match Night. So that was my first opportunity. You guys were patient with us, and really determined. As I think back on that, I think some of your counterparts even worked later into the evening, beyond the 8 and 9 o'clock to make this thing happen. So I think from a MatchNice perspective, that you guys have a team that's willing to roll the sleeves up and do the work that needs to be done. For a nonprofit leader who might be skeptical about doing matching and that kind of stuff, I just my experience, having gone through this, is it's just as much work as trying to cultivate a donor, but sometimes it brings about different donors that you wouldn't necessarily have expected. And I kind of alluded to that earlier, right? Where you saw $5 gifts, and you have different conversations at different times with folks, and you hear things like, "Had it not been for that match, I don't know that I would have given the $5, right? Because I didn't know that impact would really make a difference." And then I just like, you kind of mentioned it earlier, the gamification side. It does psychologically, I think, become a game. And it just kind of, if you're able to build out like teams and things like that of people to spread the word, it's just fun. And it's kind of a low lift way to be able to do fundraising, from my perspective, not discounting the fact that folks in the development world are doing a lot of work behind the scenes, but from an executive director, president perspective, uh, it was relatively easy to do, and talk about and get off the ground.
Well, Roy, we really appreciate all the work that you all do in Missouri and really across the country with medication. It's a unique model. And, we've learned so much from our partnership. You all were one of the first matches that we launched, and we've since come out with this ABC matching framework, and you all nailed every single one of these, right? Like the align being that case statement piece. Like, why are you raising the fund? What's the case? What's the timeline, the urgency? Building and putting that match up. And then, of course, the most important part is the communication and building that trust. So, Anyone who's listening or watching this recording, you're always welcome to reach out to us. Our team is here to support, happy to help with putting a case statement together for you all. Roy, we as a company are so much better for having worked with you and appreciate the opportunity to step into this moment and are really excited to continue to support your mission in whatever capacity we can.
Sounds good. Thank you.
Thank you, everybody. Have a blessed day. Take care.